Okay, so talk to me about.
So long COVID. So what is the issue? What is the problem with the long COVID syndrome? When you have COVID infection that affects your lungs, usually in the form of pneumonia. So whatever affects your lungs, you do not produce oxygen for the rest of the body, because that's how we ingest oxygen, through our lungs. Now we have a pneumonia that impairs oxygen absorption. Problem number one. Problem number two with COVID, the virus itself penetrates the body in such way that it leads to creation of mini plaques in all the little arteries, in little arterioles. These are the vessels that supply blood to the organ, to the little vessels. They all get clogged up. Big vessels get clogged up, small vessels get clogged up. So now, what does blood do? Blood delivers oxygen. Now, what is the problem? Your lungs are affected, you don't get oxygen. Your blood vessels are affected, you don't get oxygen. So you have a problem. You have a problem with any organ system. Liver, kidneys, heart. And most importantly, this is what people are going to be complaining of, is brain, right? People are not going to come and tell you, look, doctor, my kidneys are, having a problem after the COVID. No, their function might be abnormal because they have the blood tests are going to be abnormal, but the patient is not going to be complaining about kidney issue. What are they going to be complaining about? Whatever is related to the brain. Memory loss, the inability to sleep, the chronic headaches, the inability to concentrate, the cognitive dysfunction, the foggy brain, all kinds of neurological things, right?
Some people are getting vertigo as well, correct?
Vertigo, absolutely. And what is the problem? The brain was lacking oxygen because of these two issues. Bad lungs because of pneumonia, and microvessels in the brain. They got clogged up. Well, do we have a medication for this? No, we don't. We do not have a single medication for long COVID. Where does the leech therapy comes in? Leeches, or Hirudotherapy, the active ingredient, the number one and the most important active ingredient in a leech saliva is hirudin. It's a protein which is a blood thinner. It is the blood clot buster. So by delivering hirudin to all these little tiny vessels in the brain, and not necessarily only in the brain, but we can do the same thing for the kidneys, for the liver, for any other organ systems. But this is how we treat the brain. We are going to bust the clots, and we're going to resupply the brain with oxygen. This is why Hirudotherapy, or the leech therapy, is incredibly useful for long COVID syndrome. It is used in many countries where Hirudotherapy is being practiced. We're not using it in the United States. I'm the leech doctor, I'm the leech MD. I'm one of the very few medical doctors who embraces this therapy in the United States, not just for surgical or cosmetic uses, but for therapeutic uses in neurology, in internal medicine, and other conditions. So long COVID can be treated and should be treated by Hirudotherapy or leech medicine. Come, fill out the form, call us, and we will explain to you further how we can make a huge difference for your symptoms.